All right. Welcome to another edition of Team Ambition Podcast. I'm your host, I'm your coach, I'm John Robinson. And today we're going to talk everything mental health. And who better to do that with? Lauren, hope I don't mess this up, Marchefka.
Marchefka.
Okay, with a bunch of letters behind her name. And we're going to dive into that. So welcome.
Thank you so much for having me.
Absolutely. Absolutely. So I'm going to dive right into it.
Okay.
Straight into it. So I call them F3s, friends, followers, and family. You put them whatever order you want.
Okay.
F3s. So tell our F3s a little bit about you, your practice, and everything related to it.
Okay, yeah. So I am a family and psychiatric nurse practitioner. I've been working in the integrative, more holistic space pretty much my entire career. It's been almost 14 years. I started off when I was 25.
Okay.
And, I've always I've worked in the integrative mental health space. Actually, I originally started off working in internal medicine.
Okay.
And so I was taking care of patients who were really, really sick. And the doctor that I was working with, he was really into the holistic space / functional space.
Yes.
There's kind of like a big spectrum on holistic and functional. But for functional medicine, for people who aren't really sure what that is,
Yes.
it's really looking for root cause.
Okay.
Right? So we're looking beyond what symptoms you might be having and trying to understand what metabolically might be going on for you so that it makes sense, so that we're treating the root problem as opposed to just putting a Band-Aid on it.
Yes.
Right? And then the holistic side is more of the we're including things that are lifestyle based, right? So we're thinking about, movement and light and sleep and hydration and nutrition and all of those pieces. And so I've always been interested in kind of using not just medications for people who want or need them, but also using things like supplements and lifestyle modification to really help people feel their best. And around 2017, I started to really get into mental health, actually. I was working at in San Diego, and I was working at a clinic called the Brain Treatment Center.
Okay.
I was the medical monitor for a clinical trial where we're using EEG guided TMS to help with PTSD and TBI. And that is where I just fell in love with mental health. It was mostly on special force veterans.
Okay.
And they were really, really struggling. And even though the clinical trial that they were part of, where they were getting this special kind of TMS, which is a special giant magnet, basically, that helps change how fast the brain is firing, they just were looking for something more. And one of my clients, he went to Balboa Hospital.
Yes.
And his neurologist gave him IV ketamine, and he came back and he was like, "Lauren, this changed my life. You have to learn everything you can about ketamine." And I was like, "Okay, you've convinced me. I'm down." And so I got a job working basically part-time on the weekends at this ketamine clinic.
Yeah.
And I was just absolutely blown away by the transformation that people had with it. And then from there, I got even more inspired, and I went back to school, and I did a certificate in psychedelic therapy and research. And I did the MDMA training through MAPS, and I continued to kind of work with ketamine, and now I do. Now my practice is mostly focused on doing ketamine-assisted psychotherapy, integrative mental health, and physical health, mental and physical health, right? Because it's one and the same for me.
Absolutely.
And then I also will do certain wellness retreats using psilocybin in Jamaica.
Oh, wow.
Yeah.
Jamaica.
In Jamaica.
I've never been there, but I'm pretty sure that's a really good experience for not just obviously for the the fun side of it, but for the purpose of being there. I can imagine that what your patients get out of that.
Yeah.
So, so you were at Balboa. So keep me honest. So you're originally from San Diego, California?
I'm actually from Michigan.
Okay.
I'm from Michigan. I went to school in North Carolina. After I was at school in North Carolina, I really wanted to travel, and I took a travel nurse job, and my first travel location was actually in San Diego, and I was like, oh gosh, I'm never leaving. I was like, I love it here.
Yes. So I've only been in when I was in the Navy, I was in San Diego for 3 months. It's very beautiful city. Very beautiful city.
Yeah.
So I can understand why you want to stay out there.
Oh my gosh. I loved it. And while I was in San Diego doing a travel nurse assignment, I was finishing my master's to be a family nurse practitioner. And as soon as I finished, I was really lucky that I got a job working kind of like north of Los Angeles in a town called Thousand Oaks. And I was working for the integrative mental, the doctor that I was talking about that did internal medicine, treating like the sickest of the sick. And he really kind of like took me under his wing and showed me all of the ways to like practice holistic functional medicine. So I really kind of give him all the credit for like, helping me get to where I am today.
So, as I was doing my homework on you, prior to us sitting down to have this conversation, you have so many letters behind your name. I didn't know if this was a brand new alphabet or not. So I'm gonna say these out loud, and you can, tell us what it means.
Okay.
So you have FNP, BC.
Family nurse practitioner, board certified.
Okay, awesome. PMHNP, BC.
Family nurse, psychiatric nurse, mental health nurse practitioner, board certified.
Moly.
It's too much.
All good. And then you have another one, DMP.
Yes.
C.
Yep. So I'm doing my doctorate of nursing practice, and the C stands for candidate, since I'm still working on my dissertation.
Holy moly, that's a lot of education behind behind your experiences, all the things you're doing. So that's very impressive.
Yeah.
God bless you on those things. So
Thanks, it's a lot of work.
I can imagine. How much longer do you have left in your doctorate program?
I have about 14 months.
Okay, so you just started then, right?
No.
No?
No.
Okay.
No. No, it's been a work in progress. Yeah.
Understand.
Yeah.
Okay. So so as you talked about like the mental health space, so let me say this for myself here. So I probably say over the last 2 years, I've been very interested and intrigued about mental health.
Yeah.
Not to the point I want to have, all these letters behind my name like you. And again, congratulations with that. But I've just been very intrigued with human behavior, right? Just at a lower level, human behavior, understanding why people act the way they act, why do people do the certain things they do, their mindsets and stuff like that. So I've found that that's actually helped me coach other people.
Yeah.
So, but one of the things that I definitely, if there's nothing else I really want to lean into is like, not right now, but I probably say, and you can please keep me honest because you probably have more perspective or information than I do, but maybe over the last maybe 5 or 10 years, maybe if not more, anxiety and depression has been like a huge topic. So I would love to lean into that conversation and definitely get your perspective, your experiences and your thoughts on, we could talk a little bit about anxiety and depression.
Yeah.
Sound fair?
Absolutely.
Okay. So when we talk about anxiety, depression, let's talk about what is anxiety, what is depression. So, because some people hear it and maybe they don't even know what really it is. Yeah. Maybe they currently go through it and didn't have a title for it, right? So, and to you, like, what is anxiety and what is depression?
Yeah, that's a great question. So anxiety is, from a symptomatic standpoint, right? It's where you can have racing thoughts. You can sometimes be just worried about everything and anything, right? So there are certain types of anxiety where you're mostly just focused on one thing, and that doesn't necessarily translate into generalized anxiety, which according to the DSM, which is like the psychiatric Bible, like how you diagnose people, to have generalized anxiety disorder, you have to have it for a minimum of 6 months, and it has to be affecting your daily routine, right? It has to be affecting work and your ability to kind of care for yourself, and it shows up in places that, it affects your sleep, right?
Yes.
And it's kind of consuming your day in a lot of ways. And it's not just about one thing, it's about everything, right? Like you're worried about your kids getting to school, you're worried about your job, you're worried about this, you're worried about that. And I really feel like people have way more anxiety today, a lot because of social media.
We're going to lean into that.
Yes.
Okay, yes.
Oh my gosh, social media for sure. And same thing with depression, right? So depression is another one of those things where, just low mood, maybe low appetite, difficulty sleeping, you're maybe waking up early. You can sometimes just lack of motivation. You don't want to do anything. Things don't bring you joy or peace anymore. You don't want to hang out with your friends.
Yes.
You can kind of isolate. So it can look different ways for different people. I'll be honest. I do like very non-conventional psychiatry,
Okay.
which means I like don't really care about the diagnoses as much.
Okay.
I feel like people want a diagnosis because they want to kind of say
A title.
yes, and they want to blame it, and they say, "Oh, I have depression," so like they can kind of justify their symptoms based off of that. When in reality, I feel like this, you're constantly changing. Every day is different. It doesn't have to be the same. And maybe one day you're hitting all of the like criteria to be diagnosed with depression, but maybe the next day you're not, right? And so I feel like it's ever changing. And I don't know. For me, like I said, I don't get terribly excited about
Yes.
labels. Of course, like if people need diagnoses
Yes.
and they're like, please give me a diagnosis,
Yes.
like I will give them one. But I also like to kind of have a conversation about like what that really means, because really we're just labeling all of their symptom clusters. And from an integrative/functional medicine standpoint, I'm looking at, well, what's causing that,
Yes.
right? Like for me, maybe you're showing up more depressed, right? You have low motivation. You're feeling like don't want to connect with your friends anymore.
Yes.
You aren't hungry, like nothing brings you joy. But maybe you are a perimenopausal woman and your hormones are completely out of whack.
Yes.
And this is normal and expected, right?
Yes.
Like we know that we're going through hormonal changes, but sometimes women don't realize that, and they're like, something's wrong with me and I just don't know what it is. And then they go to the doctor and they're like, oh, you're depressed. And
Yes.
they're not necessarily looking at the hormones. Or maybe there's like a nutrition deficiency, right? So like certain nutrients play a really big part. Vitamin D is like one of the biggest ones, right? So especially when we're thinking about seasonal affective disorder, it's actually usually low vitamin D levels. So like people in like the northern states, right?
Okay.
Like Michigan, like where I'm from. People have low vitamin D. You're not out in the sun. You're not synthesizing it as much, right?
Because maybe it's the cold.
Be cold, but also you're not getting the sun, and also you're not having the cofactors that are necessary to create vitamin D in your system. So a lot of times you can kind of really help support people with seasonal affective disorder if you just check their vitamin D level and put them on vitamin D.
Yes.
Right. But if you go to your traditional doctor, they might just be like, oh, you're depressed.
Yeah.
You have seasonal affective disorder. You know what I mean? Like, here's your label. Good luck.
Yes.
Or they'll put you on a medication, right? And a lot of people don't want to be on medicine.
No.
They don't. They don't like the side effects. They don't like how it makes them feel. And then after 3 months, it stops working. And so, especially like what I do, I feel like it's really unique. There aren't as many practitioners who really specialize in like the more holistic mental health space, right?
Yes.
And so when you want help with your mental health, your options, most people are like, oh, I'm just going to go to my psychiatrist or maybe my psych NP, and then they're going to get a label.
Yes.
And then they're going to get a prescription. And that's what Western psychiatry looks like.
They get medicine. Well, hey, you get this label, or you get this diagnosis or label, get the medication, and then come and see me in like 3 or 4 months and see how that goes.
Yeah. And a lot of times, what happens is they'll put them on something, and maybe within the first 2 weeks, they're kind of adjusting. There's usually a lot of side effects in the like first week or so. And then maybe they're going to feel a little bit better. And then maybe in like a month, they're like, oh, it was helping, but it's not helping anymore. And they're like, okay, let's go up on your dose, right? Okay, now how are you feeling when we check a month later, right? And they're like, no, it's not working at all. I'm worse than when I started. I hear this all the time. Okay, so then the next step is let's try a different class of medicine. Okay, let's try this. Oh, come back in a month, right? And we play this game where we're constantly just cycling through different classes of medications, increasing or decreasing the doses depending on side effects and tolerability. And patients, meanwhile, are still nothing is being talked about their diet, their internal dialogue that they're having with themselves, whether or not they're drinking any water, whether or not they're drinking too much alcohol or caffeine or whatever they're putting in their body, right? No one's talking about movement. No one's talking about sleep. I mean, they might ask, like, oh, how are you sleeping? But that leads to, oh, would you like to try trazodone or Ambien, right? Like, which cocktail do you want? So it's really the traditional psychiatry, like the world of psychiatry, I just feel like they're not really addressing the root problem. And it's not to say that they're doing it wrong. It's that this is how they're trained, right?
Yes.
Like when we go into the traditional Western model, that's what they train us to do. They're not really training us to like look at the root problem
Yes.
and to assume that there might be something else that could be contributing.
Well, you know, it's funny you say that. So, like, yesterday I was having a conversation with a friend of mine. She was actually getting seen by a nurse practitioner for some hormonal things, yada, yada, yada. And, you know, one of my questions was, like, she did labs on stuff like that. Great, fantastic, do those. I was like, did I can't remember if it was he or she. But it was a female who I was having a conversation with. I was like, hey, what about your lifestyle changes? Did they actually, like, how's your sleep? What are you doing for, you know, traditional exercise? What are you eating? Like you just said, the lifestyle habits are the potential root problems.
Yeah.
She was like, no, they didn't ask me any of that. And I was like, okay, well, do me a favor. She's supposed to do another appointment, I think, in like a week or two. I was like, hey, ask those questions. Like, when they ask, like, hey, I'm doing this, this, and this. You know, how is that playing a role in my XYZ findings or whatnot? So I think when you said that, it brought me back to my conversation yesterday.
Yeah.
So.
Yeah. And when you go to your regular doctor or your regular psychiatrist or PsychNP or something, and you're like, oh, I'm doing all these lifestyle changes, they're going to be like, yeah, that's nice.
Yeah.
Oh, good for you. Okay. You know, here's your medicine. Right?
Sheesh.
I know. It's really, it's really hard. It's
yes.
really sad.
Well, hopefully, you know, hopefully some of the other clinicians or people within your space are, you know, practicing those same methodologies. Even if, you know, they're not doing the exact same thing, maybe just still ask those root problem questions, right?
Yeah.
Okay. So we talked a little bit about anxiety. Does anxiety, if you have anxiety or if you have symptoms of anxiety, do you think that plays a part into depression? How does that work? So in other words, transition into a little bit about depression.
Yeah, absolutely. So a lot of times people that are anxious, sometimes then they get depressed about having this sensation where suddenly their heart is racing. Suddenly they're feeling like they're having a hard time catching their breath, right? Like from a physiological standpoint, anxiety can show up in, you know, like sweating hands
Yes.
and like feeling like you're going to pass out, right? Almost like precipitating a panic attack in some regards, right? Where you feel like you're literally having a heart attack and
Yes.
it's absolutely terrifying. And then so sometimes people get so worried about having anxiety itself. They like worry about being worried that it makes them depressed. And there is a lot of people have both, right? I feel like I very rarely see people who have anxiety alone or depression alone. They're usually comorbid. They're occurring at the same time, and there's always kind of like a mingling between them. Once again, from a functional medicine perspective, yes. I'm immediately thinking, okay, well, what is the root of this that you're experiencing these symptoms, right? Like I'm going one level deeper.
Yes.
And I'm looking at, what are you eating? Do you maybe have some underlying food allergies that are not being addressed? Do you have what we call leaky gut, which is where the gut lining is impaired? And so when you eat certain things, it causes inflammation.
Okay.
So a way to think about it is you have like, you know, your gut kind of looks like these little villi, right? They're
yes.
like little fingers.
Yes. I'm tracking this.
And when you eat something, and let's say you're eating something that your body doesn't like, a lot of people have sensitivity to like dairy or gluten.
Yes.
These are like, or processed artificial sugars, things like that, right? Your body just doesn't know how to process some of these things depending on you and your makeup. Right. And so it goes in and it causes inflammation, and it causes like these little kind of widening and damaging of the little fingers. And so then you can't absorb nutrients the same way. Your gut starts to become inflamed, and then suddenly you're having like constipation, diarrhea, bloating, gas,
yes.
All sorts of kind of like GI symptoms. And then you're starting to notice that you're having a bit of brain fog, and you're starting to feel a little bit more anxious and a little bit sad, right? And so it's like these little kind of things that are coming, and not recognizing that the gut and the brain are intimately connected, right? So the brain is where a lot of neurotransmitters are made. So 70% of serotonin is actually made in the gut. And you know, not everyone knows
yes.
that, right? But if you have an impaired gut lining, you're not absorbing nutrients the way that you should be. You're not also getting the same nutrient value from like the food you're eating. You need certain things like copper, magnesium, B12, zinc
yes.
to help create neurotransmitters. And so if you don't have those, you know, a healthy gut, you're not going to be able to create these things in the ratios that we need them for like optimal balance. So I'm always looking at the gut to kind of
yes.
say what's going on with you. Also, when the gut is upset, right, there's usually more inflammation. So I check HSCRP, which is a highly sensitive inflammatory marker. And when that number is really high, I'm immediately trying to figure out, why is there so much inflammation in your body, right? So if you're eating foods that are non-organic,
Okay.
they're sprayed with herbicides and pesticides, that also goes in and breaks up the microvilli in the stomach, right? And so that's just another thing that assaults our GI tract. And so it creates this state of hyperinflammation for people. And, so there's all these kind of things that can be attacking. There's bacteria that naturally lives in our body and in our guts.
Yes.
And then when we are eating things that we shouldn't, or we're getting exposed to too much toxin exposure, then we're starting to kind of notice that all of these symptomatic things are happening to us. Like sometimes you're getting rashes, or like you're getting eczema.
Yes.
You're getting like rashes around the mouth, right? You're getting like the darkness under the eyes. You're having low iron. Like it's all connected. Like it's all one body. So when you take apart like just one symptom, right? For me, I'm never like, oh, you just have depression. It's like, what's causing it? And it's usually a combination of things, right? And always people are having difficulty sleeping.
Oh my gosh.
Sleep is like the pillar, like the number one pillar of health, right? And the number one pillar of mental health in particular, because when you get enough sleep, you're like, oh, everything's okay.
Yes.
Right?
Yes.
It really is.
Yes.
And but having things like sleep apnea, right, where you're basically not breathing as well throughout the night, your oxygen saturations are dropping for whatever reason, that's causing more inflammation everywhere. And that's another thing that causes that inflammatory marker to go up, and just overall inflammation in your body. You're feeling tired, you're feeling brain fog, you're feeling lethargic, you can't get through workouts the way that you used to, right? Recovery's that much harder. Your muscles are really sore. You have more lactic acid buildup, right? Like it's all a big piece of the very complex puzzle that you are.
Man, that was a great breakdown. I have a two-part question for you.
Okay.
So when it comes to anxiety and depression, how do you treat it?
Yeah, so I treat it by trying to figure out what's the root problem.
Okay.
So I take like what I call the 4 pillars.
Okay.
So pillar 1 is going to be body. So when I think about body, I'm thinking metabolic. I'm looking at nutrient deficiencies, food allergies. I'm thinking about bacterial infections, viral infections, periodontal infections, things happening in the mouth. You would be shocked at how much inflammation is actually in the mouth, but it's all connected, right? Your mouth and your gut are connected. And how that contributes to a lot of symptoms. So I'm looking at hormones, not just like, like thyroid, but also all of the, the testosterone, progesterone, estrogen, DHEA, all the really important markers that really give you a more clear indication of what's happening in your body.
Yes.
I'm looking at cortisol levels, right? What's your stress level like, your adrenals? So that's kind of like what I'm thinking about with like the body, as well as like hydration. What are you drinking? What are you not drinking? What are you drinking too much of? Like that whole thing, what kind of food are you putting in your body? What's your relationship with food? Do you have a certain diet that you're following, right?
Yes.
And then the next thing I'm looking at is like emotional, right? So I'm thinking about what's the internal dialogue that you have with yourself? Like what's the kind of conversation that you wake up and start your day with, right? Are you someone who wakes up in the morning and you're like, oh, it's going to be an amazing day? Or
that's me.
That's you. That's you, right?
Sheesh.
Or are you going to be like, ugh, I'm awake. I didn't sleep well last night. You know what I mean? Like it's just how, like, what's your outlook on life? What's showing up for you? Do you have aches and pains in the body that might be connected to trapped emotions? I'm looking at social, right? Like,
this is so interesting. I'm so sorry. This is so interesting.
I'm so glad. I'm looking at social, right? Like, who is your community? Like, do you have a community? What do you participate in your community? Like maybe not just locally, but like maybe from a statewide perspective. Do you have like friends that you get to hang out with?
Yes.
What's your relationship with, like, do you have a spouse? Do you have a girlfriend? Do you have kids? Like, I'm looking at all of those different social interactions, right? And then lastly, I'm looking at spirituality. Like, and that doesn't necessarily mean religion, but I'm
Right.
thinking about, what do you think we're doing here? What's our purpose? What do you think your purpose is? Do you
Yes.
have a purpose? Have you thought about your purpose? Do you have any kind of spiritual belief? Do you practice religion? Do you pray?
Yes.
What does that look like for you, right?
Yes.
Because for people who, and then I try to help you find balance in each of these areas. Because for me, I feel like you can't really truly have health if you are out of balance in any of these places. So when I meet with you, I go through each of these sections. So for someone who's maybe like perfect, let's say perfect diet, right?
Okay.
Like all organic, like the perfect amount of vegetables
Yeah.
and proteins, and making sure that they're doing all the right things and they support their liver and they have perfect sleep and they don't stress about anything, and maybe they have like an incredible family and life, and then they they go to the gym and they have their gym community, right? Which is some, like, a lot of times like your second family. And then spirituality, when I'm like, what's your purpose? I don't know. I don't have a purpose. And right. So then I'm thinking, okay, for you, this is where I think this depression and anxiety is stemming from, like this existential, why am I here? And if you're like, so many people don't believe in anything outside of us, right? They're like, I don't know why we're here, and I don't care why we're here. Like, there's not a God, there's nothing bigger. You know what I mean? And those people, I feel like, are sometimes the hardest ones to break through to, because if you don't feel like we have a purpose, it's so hard to help you create meaning for your life.
Yeah.
Help you see it in a way where suddenly things can be joyful, right? Because even if you're doing all these right things, if you don't feel like you have a reason to be on the earth, it's so hard. It's so hard. And I treat a lot of these people who are like, I don't believe there's a God. I don't believe I have a purpose. And like, those are the ones that are really difficult to like pull out of that rut, especially if they're doing all the other right things, right? Like maybe their hormones are optimized and they're eating right and they're sleeping and they're going to the gym, right? A lot of them, interestingly enough, are like really high achieving businessmen.
Okay.
Who are like, what is my purpose? Like, I have everything and I'm still not happy, right?
Wow. Because
they don't believe that like there's anything bigger than them.
Oh, wow. Okay.
Yeah. And so it's incredible to work through that with them. And a lot of times the way that I do that is through a psychedelic assisted therapy journey.
Okay.
So whether we're doing like psilocybin or if we're doing ketamine, that kind of experience is a transformation that helps you see things from a different perspective. And so when you have a psychedelic journey, there are a few different themes that come up for people that is very interesting because it's very universal, right? And a lot of times people come out of it, no matter what psychedelic you're doing. I mean, there's variations between all of them, but a lot of times people come out and they're like, oh my God, like there's like a God or there's something more than us out there, right?
Yeah.
And for someone who has never felt that way to then have that that revelation,
yes,
that's when you see change. That's when things start to pivot, and then like all the other things start to fall into place. Or people will have this journey and then they'll come out and they'll say, wow, I want to live now.
Yes.
I want to live. Like I felt love and peace and bliss, and I've never felt that in my life before. And now that I know what that feels like, I can take that forward.
So let me ask you, what does that do for you when you see and hear and see that change, that light bulb, that aha moment, right?
Yeah.
It's called aha moment.
Yeah.
What does that do for you?
Oh my gosh. Well, it's honestly such an honor to hold space for people and to like watch them witness it, because I really truly believe that for those experiences to happen the way that they do, you have to have the right, what I call container, right?
Okay.
Where they're in the right setting where they feel safe to like let go and be in an altered consciousness, but then also be supported enough in like the mindset that like, okay, like I'm in a safe place. I'm open to this new opportunity. I'm going to see what comes. I'm going to allow what comes for me and move through it, and to like let me hold them while they move through it. Because sometimes big things happen in their experiences, right? Like they're screaming, they're yelling, they're like kicking, like all sorts of things. There's a lot of somatic energy that can be moved through with these kind of psychedelic journeys. But just when they're really maybe feeling overwhelmed, and then for me to kind of put my hand on them or hold their hand, and they're like, oh, thank God you're there.
Yes.
Like, thank you so much. And just to kind of be the voice to say like, hey, I'm here. You're safe.
Yes.
You're doing great. Keep going, like, and kind of guide them through it. It's just like, it feels like soul surgery.
Yes.
Honestly, like, but they're doing all the work. I'm just
Yeah.
there supporting them.
Yes.
So, I mean, honestly, like, there are truly no words, because until you sit there and like hold space for someone and like watch them have that experience.
Yes.
You can't, you're just so happy that they came out of it with that realization.
Yes.
And then once again, it's like humbling and honoring to be able to hold that space for them.
Love that.
Yeah.
Love that. When you talked about spiritology, if I can get spit the word out, first thing that came to my mind was obviously, believe in higher being, whatever
Yep.
person believes in, God, or,
Yep.
Whatever your religion is. But when you talked about purpose, like when people, there's people that you had the privilege of treating, or, your patients who don't have purpose, and you help them find purpose. I think that's very impressive. To my recollection, I don't think I've had that happen before. I don't think I've had a person that I've coached that said, I don't know my purpose, or I don't have a purpose. But so that's why I was like, this is interesting, because I don't think I've ever witnessed that. I don't think I've ever met anybody who's ever told me, to my knowledge, like, I don't know my purpose. But to hear it, that, even high level, high performers don't feel like they have a purpose, and they've been doing X, Y, Z, whatever that is.
Yeah.
That's just, I don't know, that's just impressive to me.
I mean, I'm not really doing anything.
You're guiding them to find
it.
Excuse me.
It's all them.
So.
It is all them. But sometimes they need, how often do you go to the doctor and someone asks, do you feel like you have purpose? Like,
True.
Like, who asked that?
Yeah, true.
You know what I mean? Like, I think a therapist might ask that, maybe. But not everyone wants to go to therapy.
Yes.
Right? There's a big stigma around therapy, feeling like, oh, I need help, and I don't need help, right?
Yes.
But if you're in a space where not like it's unsuspecting, right?
Yes.
But you know what I mean? Like, it sneaks up on you. Like when I'm in a visit with someone and I ask them, like, what do you think your purpose is? Or do you have purpose?
Yes.
And I think maybe because I do work in the mental health space, I feel like that is a big thing that people struggle with. So it comes up so much. And there are some people who are like, I know my purpose, but there's something holding me back from my purpose. And then that's part of why they're coming to see me, right? They're like, I know there's something wrong. There's something going on with me and I can't figure out what it is, but I know I have a purpose and I know this is my journey, but I don't know how to get from here to here because my motivation is so low, or my energy is so low, or my brain fog is like just preventing me from seeing things clearly, right? So I work with them to kind of, once again, and this goes back to like, how do I treat it? It all depends on what the root problem is, realistically.
Yes.
Right? And usually it's a combination of things. But sometimes, like, for example, so many women who are in like perimenopause, right? Who are just starting to feel the hormone changes, but are not quite in full like menopause symptoms. They are like, oh my gosh, something is not right. I'm going to kill my husband. He's breathing again. How dare he breathe? And they're like, oh, and it's suddenly hot, like little things, right? Like, not like, oh my gosh, you're definitely in menopause, but just like little subtle changes. And then they go to their doctor and their doctor might say like, oh yeah, you're going through menopause. But if they're not into hormones or balancing hormones or supporting hormones, they're going to be like, oh, they're just going to give them a label.
Yes.
And be like, oh, would you like to start an SSRI? Which doesn't help fix the problem of the hormone changes, right?
Yes.
And so when I see female clients who are kind of in that phase of life, I'll meet with them and I'll say, what really resonates with you? I'm always starting with lifestyle first, right?
Yes.
We're starting with the sleep. How can we better support the sleep? The movement component. How can we support the movement? How can we get you motivated, right? And not just like, I really try to meet people where they are because, like when just sometimes trying to get people to like walk outside for 5 minutes
is a challenge.
Is a challenge. And then I'm like, I really need you to do weights. They're like, absolutely not. I don't want to get bulky. And it's like, no, that's not what's going to happen.
Yes, it doesn't work like
It
that.
doesn't work like that, right? But so many females, I'm like, no, weightlifting is like the key to longevity. Like, you got to do weights. And, you know, you need to also be doing cardio, and you need to be doing stretching and restorative, right? Like, you can't just do one kind of movement too. And then that gets really overwhelming for people. And that's why I try to give people only 5 things to do. When they come to see me, I'm like, here's your 5 homework assignments. And then when we come back, I'm going to see how you're doing, and then we're going to build.
Yes.
Because I feel like so many people just skip to, here's some pills that's going to make you feel better. And then once again, you're not treating the root problem.
You're just putting a Band-Aid
You're just putting a Band-Aid on it. And then this is going to be how it's going to be forever. And maybe you want that. Like, some people are like, no, just give me the pill. Like, I don't. So many times. They're like, I don't care that my cholesterol's high. I'm just going to take the pill to make it go down. I'm like, that just makes it go down, like, on the lab, but you're still eating horrible food. Like, that's not, we're not changing the problem here. Like,
not
this
at all.
Lifestyle. And then, you know, so once again, like, SSRIs are not going to fix a perimenopausal woman's hormones.
Yes.
They're just not. Maybe it'll make you feel better. Maybe it won't. But realistically, just, you know, I try to figure out what the root problem is. And so let's say I start her on hormones, or I start giving her some supplements to naturally support her hormones, right? And maybe I got her on a good workout plan and she's sleeping better. And maybe she's going to be 80% better, right?
Yes.
Then I'm going to say, what are we missing? What's the other piece that's contributing? How can we continue to find balance in all of those pillars that we talked about earlier, right?
Yes.
So it's really important to just meet people where they are and, like, support them through whatever healing journey they're on.
Okay.
Yeah.
I'm gonna lean into another thing that you said. I had this light bulb go off. I found purpose in this conversation. So I'm joking. So when you talked about therapy, so I'm gonna use me for example because come to grips with it myself. I wholeheartedly believe that people should do therapy. Yeah. You asked me that 5 years ago, I'd be like, people shouldn't do therapy. But I went through therapy myself and came out such a better person, right? Yeah. Had a great therapist. So why do you think people are not going to use therapy? That's one. And what would you say be the benefits of therapy from your perspective?
Yeah. So what a great question. Because I feel like there's so many, well, first off, I think there's a few reasons why people don't want to go. And then I would love to hear why you were like, absolutely not. 5 years ago.
Absolutely.
I want to hear about it. So I feel like there's, first off, people have to admit that they need help, right? Because you're not going to go to therapy unless you're, like, being forced to.
Yes.
And so just admitting that you need help, I think, is hard for a lot of people. Then after you admit you need help, then the question is, okay, maybe I know I need help, but, like, am I going to ask for help?
Yes.
And especially a lot of military, they're like, absolutely not. You are not trained to ask for help. If you ask for help, you're a little bitch.
Yeah. Spot on.
Right? Like,
spot on.
You better suck it up and not say that again.
Yes.
And then, you know, and then it's like, I feel like there's just a stigma. Like, it's a sign of weakness. Like, and oh my gosh, like, I need to talk about my feelings. And they're like, I don't want to do it. I think people don't want to do therapy too because it forces you to have a mirror of yourself. It's a reflection of yourself. And people are like, I don't want to know what I'm doing wrong. Yeah. No. You know what I mean?
Yes.
I think too, it's actually really hard to find a good therapist.
Okay.
And it can be difficult to find someone that you feel comfortable enough to, you know, say what you want to say and not feel judged. Because some therapists, and my husband would allow me to talk about this, but like when he was trying to go through therapy, every VA therapist person he felt so judged. Like they were way too busy. They wouldn't make eye contact with him. They were like, what's your problem? Oh, you were blown up by an IED. Okay. Uh-huh. Oh,
wow.
You can't sleep? Do you take pills? Okay. You know what I mean? Like,
wow. So he was a number.
For sure. His experience was so horrible. And he was like, I'm not going to tell him like how I'm feeling because he doesn't care.
Yes.
And then the therapists who are maybe a little bit more, someone that maybe he would have been more interested in seeing outside of the VA system, are really expensive, right? Therapy can range between like $150 to like $400 per session, right? It gets costly. So I think there's financial barriers as well. And so, I mean, there's like, once again,
Yes.
it's like multifaceted on like why people don't actually get the help that they need. Also, sometimes people are looking for someone who specializes in like what their complaint is, right? So like maybe they're looking for someone who specializes in PTSD, or maybe they're looking for someone who specializes in like LGBTQ or
Yes.
whatever, right? Like, and so that can sometimes be hard too, to find people who have your niche. Some people resonate better with like certain genders, right? They're like,
Yes.
oh, I only want to talk to a guy, or I only want to talk to a female, or whatever it is.
Yes.
Um,
Man, you're spot on. I'm as you're talking, I'm
Yeah.
like, damn, that's
That was me.
That's me.
That was me.
That's me.
That's me.
That is definitely me. So yes, you are that. Damn, you're spot on.
Oh my gosh. Yeah. So those were the reasons why you didn't want to go.
Yeah. So I didn't mean to cut you off.
No,
I'm so
please.
sorry. But so about 5 or 6 years ago, when I was in the military, I used Military One Source, so
Yeah.
it was free. So the financial barrier, I definitely get that part. So they referred me to a guy. I don't remember names, unfortunately.
Yeah.
But the first guy, male I had, just like your husband was feeling, like I would tell him, I didn't tell him everything, but I would just give him a little bit of the reasoning, and it was just like, okay. He was like, okay, great. I have these books I want you to read. I'm like, that doesn't do anything for me. I mean,
No.
I appreciate the books, but that doesn't. I don't have no interaction, so that didn't work. So I went to another lady. She's actually here in Jacksonville. I never met her, but it was all. It was like telehealth, right? I didn't see her. It was all over the phone.
Yeah.
I did 12 weeks, I think. 16 weeks with her. Best time in my life. Best time in my life. I'll never forget this because I carry this with me. I would do all the talking, which is I'm supposed to do, right, for the most part. And then she would like chime in and give me some different thoughts. But she said this to me. I never forget this. She was like, a lot of times we know the answers. We just got to say it out loud. And when she told me that, I was like, damn, you're right. Because I would say these different things out loud, knowing that, and inside my mind, I'm trying to convince myself to do X, Y, and Z. But when I say it out loud, you know what? I said it out loud. I need to do X, Y, and Z instead.
Yep.
So that experience for me was just life-changing, honestly. It helped me grow as a man, as a husband, as a father, as a coach, right? As a person, I guess. So I wholeheartedly believe that if anybody needs therapy, don't be scared to do it.
Yeah.
It can change your life.
Yes.
But you're absolutely right. Finding a good fit is just as important. So yes.
Yeah. Yeah. It's so hard to find the right fit sometimes. And
Yes.
then sometimes it might be going well, and then they'll say something, and then you realize that like I have some, because I recommend therapy to almost all my patients.
Yes.
And they'll go and see their therapist, and it's going really well, and then the therapist did something, and it was almost like they broke that trust because
Oh,
they
boy.
said something that like just really rubbed them the wrong way, and then they're like, oh, I'm not coming back because you made me feel some kind of way about saying this. So in a lot of ways it can be really, it's a delicate relationship.
Yes.
Right. And so the therapist has to be aware of like when that rapport has been like fragmented and try to repair it before it gets past the point of not being able to be repaired.
Yes.
But yeah, I
that
know.
I can imagine. Again, like the first person was okay. Excuse me. It was like maybe 1-2 sessions. Okay, I wasn't that invested. Neither was he, I guess. But like I said, the last one was perfect. So, I can imagine how people may feel if that trust is broken because you're telling somebody your most intimate details.
Yep.
And even stuff to a point, maybe if you're married, the male or the female may be telling this therapist every little detail that your significant other doesn't know yet, maybe. And then you break that trust. That can be very heart-wrenching. So,
Yeah, for sure.
oh,
For
yikes.
sure.
Okay. Wow. Thanks for sharing that. No, seriously. So I want to lean a little bit more into the gut health and inflammation because I think that's actually very important but interesting too. So what are some of the tests or labs that are used just when you're looking for whatever you're looking for within the gut or whatnot? What some of the labs are that you guys do?
Yeah, that's a great question. So if I'm looking at blood, right, there are certain blood markers that I can check, like HSCRP, like I mentioned earlier. ESR is another inflammatory marker. I look at something called homocysteine.
Okay.
Homocysteine is really more about looking at like the detoxification to see how well your body is like detoxing. And so if that level is high, then it gives me an idea of like maybe your body needs a little bit extra support. And while that's not directly related to the gut, it kind of is, right?
Okay.
Because, the way that we get rid of toxins is they get filtered through the liver, but also we have to pee, poop, and sweat them out.
Yes.
And so knowing how your body is handling your toxic load is really important. There are all sorts of like gut health testing. It's super unfortunate because a lot of times they're very expensive.
Okay.
I mean, I guess I shouldn't say very expensive, but when you think about like in traditional healthcare, right? If your doctor orders you a lab, normally the insurance covers some of
Right.
it. And so you're not really looking at like a huge copay. But with the more specialized labs, insurance doesn't
They don't
cover
cover
that. And so you're talking about anywhere between like a $350 to like $800 stool
Wow.
sample. So I feel like it's
Wow.
pretty expensive.
Yeah, no, that is expensive.
You know what I'm saying? And
Yeah.
then it sucks because you're like, well, I really want to have these answers. So there's a few different gut health tests that I like to order. And once again, my approach is totally different than everyone else in the functional medicine. Well, not everyone else, but like than
is your
some
niche,
other
so.
functional medicine practitioners. I really try to, based off of your symptoms,
Okay.
try to figure out what I think might be contributing first and foremost. So if you have high inflammatory markers, you are complaining about brain fog and headaches and nausea and constipation and, just like overall not feeling good, not sleeping well, all these things, I'm probably going to start you off on some kind of anti-inflammatory diet just
Okay.
to bring down your inflammation first and foremost. So an anti-inflammatory diet is just cutting out things that usually cause a lot of inflammation. So like I mentioned earlier, gluten is like a huge culprit. A lot of people really can't tolerate it very well.
Yes.
They're in denial. No, that's not true. And I'm like, try going out without and then come back to me in 6 weeks. And not everyone is gluten sensitive, but just in general, the molecule itself kind of has like these sharp, like pointy, like it looks like it hurts.
I can.
If you look at
Yikes.
like the molecule, it's like a sharp, pointed molecule, right? And
Oh.
so it's poking little holes in the gut. But also there's some arguments that maybe that's actually not the gluten itself, and that really it's more because the wheat has been sprayed with things like Roundup and
Yes.
or glyphosate that has is really toxic for the human body. We don't know how to process that. We can't detox that very efficiently, and so maybe that is why people have gluten sensitivities. That's like a whole nother conversation.
Yes.
But in terms of, I usually start people off on like some kind of gluten diet or I see how much they're actually eating, right? So I customize it. I'll look at their dairy intake. And it's so funny because people will be like, oh, yeah, I usually do feel really sick after I have my ice cream, but that doesn't stop me. And I'm like, why doesn't it stop you? Why? Okay. And then, depending on what kind of sugar they're eating, right? If they're eating a lot of candy or a lot of ice cream, once
Yes.
again, or drinking a lot of alcohol, a lot of sugar. Alcohol is also incredibly inflammatory, not to mention it's a neurotoxin.
Yes.
To talk about that. Also, if you're eating, like black coffee. Black coffee alone actually is not that bad on the gut, but if you are eating it without anything else in there, it can sometimes really cause havoc on the gut system as well because it's very acidic.
Yes.
Right? So once again, I'm really looking at all like the different lifestyles and like what's your daily life, right?
Yes.
So usually I'm like, walk me through your day and like tell me about all your habits.
Wow.
In terms of like the gut health, also the interval in which you're eating, like sometimes people are doing intermittent fasting, which can be
Yes.
incredible, but for some, it depends on the body and it depends on what ratio you're doing it. And sometimes that doesn't work for you, right? Like
Yes.
maybe you're going to lose too much weight or maybe you're not eating enough calories, right, within your window, or you're eating way too late at night. Maybe,
Yes.
it all just, we got to look at all of the different levels. And then, the other piece is dye. food
Okay.
dyes.
Okay, yes.
Red
Lean
dye
into that.
40, like all of the artificial dyes, our bodies, it causes inflammation. Like we can see it. If we're looking at brain imaging, you can see like pre and post brain
Yes.
imaging with a kid who is like diagnosed with ADD, super hyperactive, who's eating a lot of red dye.
Yes.
And then you remove red dye 40, and then their inflammation in their brain looks better. It's craziness.
So
No artificial dyes.
Gotcha. I gotta say this out loud. We got a few more minutes. So as soon as you said that, certain things just triggered my memory. I met a lady about 2 months ago, and I was in this sales training in Kentucky for like 3 days. I met this lady when you said talked about ADHD in a kid. This lady, she was like, "Hey, I meal prep for my family from scratch." Okay, that's cool. We all do that, right? For the most part. But she did start doing that because of her son had ADHD and the food dyes, literally what you're talking about. So she just make all the meals from scratch.
Yep.
But the caveat to that is she'll cook all their meals it'll last for 2 months because she's a butcher. They have like 6 or 7 refrigerators or something like that, and like she would just freeze all the food. And long story short, because of all the dyes, all the things that's going on in different foods, she just she does everything from scratch for her family.
Yeah.
And she said that she had noticed that the behavior of her son changed because of how the different foods that they were eating from before she started this whole process of meal prepping or whatnot, cooking all the food for herself versus buying all these different processed foods and all that stuff like that. So those were something that I want to make sure I share. So that's interesting.
It makes a huge difference.
Yes.
Honestly, cutting out dyes and things that your body can't tolerate well, right?
Yes.
How sometimes that alone is all you needed to do to feel better.
Yes.
Like truly, like
Okay.
are you feeding disease or
are you trying to
are you
kill?
starving?
Yes.
Exactly. Yeah.
So on the screen here, we've got your website. So let's lean a little bit into your business just a little bit. So See Beyond Symptoms. So your business is Deep Sea Wellness. So talk about that. I think you just started yours up, correct?
Yeah.
Okay,
yeah.
so-
Finally, I feel like I've been wanting to have my own business for a really long time.
Awesome. Love this part.
And finally, life was like, it's time now.
Yes.
So yeah, I really just wanted to create a space where I could continue to practice integrative mental health the way that I wanted to practice it, to not feel rushed, to be able to really provide patients the care that they really need, right? Because especially in mental health, no
Yes.
one wants to be rushed in and out. Nobody wants 15-minute med check visits,
Yes.
right? People want to be heard. They want to hear that they're not crazy. They want to be validated in how they're feeling. And they want to know that someone believes in them and is really rooting for them to get better.
Absolutely.
I feel like I'm like their biggest cheerleader. Like,
Love that.
you come in and I'm like, well, how do we do?
Yes.
Cheering them along the way, really kind of supporting them through whatever they need support with. I also do the ketamine-assisted psychotherapy there, and I'll be also bringing in some fun things like some more brain imaging and neurofeedback and all that stuff down the road too.
Okay.
Yeah.
Awesome. So you just started. So this may be a loaded question because you literally just started. But let's say 5 years. Let's fast forward 5 years from now.
Oh, uh-huh.
What does that look like for you?
Oh, wow. What a question. I feel like that's like an interview question that I'm always like, why? Because like, that they want you to say like, I want to work at your company forever. You always have to make up something about.
Excuse me.
I mean, I am very collaborative. I love working with people like you and other like-minded people in the community. I feel like there's not like one provider for one person, right?
Yes.
Like it takes a village.
It does.
Like you need your fitness person, you need your nutrition person, your therapist, your coach, whatever teammates you need, your acupuncturist, right? Having like a collaborative team and like working in that, like I would love to be in a space where we're all working together to provide the patient or the person, all the different things that could really support their health.
Yes.
Right. So like in 5 years, I would love to, be part of some kind of like collective where there's like, we're all here on one roof but we're all working together, right? We all know your history. We're all supporting you in our ways that we really shine, so that you're getting the best version of your person that's supporting you. So I would love to, like, in 5 years, to like see myself working in collaboration with other people
Yes.
doing that. And then I love, love, love doing wellness retreats. Like, they are so fun. They bring me so much joy. They never feel like work. A lot of times they can be incredibly heavy, right? Because
Yes.
we're doing some really heavy work. But by the end of it, it's just so rewarding for not only myself, but for the participants as well. So I
Yes.
want to continue to do more of that as well.
Okay.
Yeah.
Got it. I got two more questions for you. Okay, so thank you for that. All right, so what would I'm gonna take a guess? You can think about 38, 39.
Yes.
38,
I had to
39.
think really hard.
Yeah.
I feel like when you're like, I don't know how old I am. Yes. Uh-huh.
So what would now you tell 21-year-old you? What would be that advice that the now you, if you can go back in time to tell the 21-year-old you?
I'm laughing because the first thing that came out to my head was like, don't go to Panama alone. That was a bad idea. That's the first thing that came to my head. Yeah. You know, everything works out the way it's supposed to.
Okay.
So I would probably just tell my 21-year-old self to, like, you know, just keep enjoy all of those amazing things that you did.
Yes.
And will do in the future.
Okay.
And yeah.
Righteous. Okay, one more question for you. So I can't take credit for this question because I heard it on another podcast. I thought this was like I love this question. I actually posted this past week on my social media. All right, if you can create one law everyone had to follow, what would it be?
One law everyone had to follow.
Yes.
Always be grateful.
Oh, that's a perfect segue. I'm glad you said that. I love that. Always be grateful. So, actually, it's not a question. This is the next thing I'm going to ask for you. Well, I guess it is a question. So, I always like to talk about gratitude. That's a perfect answer. I love that answer because it's a perfect segue. I always practice gratitude. So, I say this on every single podcast. So, what would you say? There could be 1,000 things you're grateful for, but what are you grateful for at this maybe this very moment? What is something that you're grateful for? Like 2 or 3 things that you're most grateful for.
I'm grateful to be here right now.
Thank
Honestly,
you.
though. No, it's
Thank
so
you.
wonderful to, like, be here and to connect with you and
Thank
to do
you.
this. I'm so grateful that the sun is shining.
Yes.
That we live in this beautiful state. I'm grateful for the day. Like,
Okay.
I try to live in the moment, in the present. So
Absolutely.
in this moment, this is how I'm feeling.
Thank you. Thank you. All right, so I'm going to share what I'm grateful for. So what I'm really grateful for is a lot of different things that's been happening for me and my family, but more so my 3 girls. So our oldest daughter, she just moved out. She's in Virginia. Her and her significant other, got their own place, raising their son. I love that. Our middle daughter, who's 19, she just bought her first car for herself. Mommy and daddy didn't have to help. So she did it all by herself. Really proud about that. And then our youngest daughter, she's 12. She, these last few weeks she was doing volleyball. So really proud that she's actually chasing something that she said she wanted to do, and she's actually been doing it. And she constantly wants to do it. So I speak for me and my wife on this one. So we're very, very grateful for them, growing. So
That's awesome.
So I'm really proud about that. All right. So I always before I like to close. So for anybody in the Jacksonville area, or maybe, somebody wants to do something in telehealth, you never know. How can people find you, book appointments, all the good stuff like that?
Yeah. So on my website, Deep Sea Wellness, you can book a discovery call. I also have a business line that you can call or text, which is really nice. I feel like people like to text me more than they like to call me. Like, that's like the generation and just how people like to communicate nowadays. You can follow me in my Instagram, Lauren Marchefka MP. And I have an in-person space in St. John's off of the County Road 210 inside R&R Collective.
Sensational.
Yeah.
Lauren, thank you for showing up. I had a great time, so thank you so much.
Thank you so much for having me.
Awesome. All right, boys and girls, thank you guys so much for tuning in to another edition of Team Ambition Podcast. Take care. Bye.